The jellyfish sign, which was observed in a 37-year-old in her luteal phase. When a transvaginal probe is is pushed against a hemorrhagic ovarian cyst, the content will wave or jiggle, just like the jellyfish in water. And that is why this sign is described as the jellyfish sign. Before we look at the images, let's go through a few differences between a fresh and an old clot. When a clot is fresh, it's just about a few hours up to 1 week. An old clot is beyond 1 week. A fresh clot is soft, while an old clot is firm. This suggests that a fresh clot will move on probe pressure, while an old clot will not. A fresh clot will not be adherent, still fresh, but an old clot will be adherent to the cyst wall. A fresh clot is irregular, is amorphous, while an old clot is more defined because it's contracted. The internal contents of fresh clot is fine echoes or fibrous strands, while in an old echo it is squares or layered echo. This is where one will demonstrate the typical wave-like movements of the soft and gelatinous content called the jellyfish sign, which is a classic feature of fresh clot. The old clot will retract to one end. In both, there will be no doppler flow because these are not live tissues. Because this is fresh, one will expect significant distal enhancement. Distal enhancement will be variable in an old clot. It's unlikely for a fresh clot to mimic soft tissue, but an old clot can actually mimic a solid lesion. But what is important is that the doppler will differentiate because the solid tissue will pick up color with the appropriate settings. Blood clot will not, irrespective of the age of the clot. During follow-up, the fresh clot will resolve rapidly, and old clot takes longer, 6 to 8 weeks, at times longer, to resolve. What it implies is that once a fresh clot is seen, it's a recent hemorrhage. And old one suggests a resolving hemorrhage. So now let's look at this image. So you can see this. Look at the jellyfish sign, the distal enhancement. You can see that it's not adherent, it's irregular. So this is the jellyfish sign of fresh clot. And of course, whether it's fresh or old, blood clot will not take up color, not this flash artifact on probe movement. So these are flash artifacts due to prep movement. So this is the jellyfish sign. Thank you very much for listening.